Good day, everyone. My name is Rich Jacob. I'm with Coach Blair Lipsitz and Coach Bob Bateson. We're with Western New York coaches. And today we're providing our ninth coaching training. And we're talking about psychological factors in rehab from injury. Just so you know, wnycoaches.com will provide you links to all of these trainings. We do many of them virtually these days, but we will be in person and we are available in person as we go forward. So we're looking forward to working with you continuously. Again, we have three of our people here. Our Director of Sports Psychology and Wellness, Kelly Piper, will be with us next week on student athlete wellness, which will be our training number 10. Rooted in experience, research, passion, and creativity, the mission of WNY Coaches is to foster excellence in performance and well-being of coaches, athletes, and teams through sports psychology, holistic education, mentorship, and professional development. And before we get into our training today, I want to thank also the Community Foundation of the Ralph Wilson Foundation for supporting our efforts in coach training, and also thanking Medaille College Sport Management to be a partner in this coach training effort. Coaches, before we start, if we can, we're talking about psychological factors in rehab, and we'll talk about all levels, from youth up to the professional ranks. We will talk about treatment, training, but maybe we can start, we'll talk a little bit more about prevention, but if we can talk a little bit about using strength and conditioning and other factors to help prevent injury. Can we talk a little bit about prevent injury to start? Coach Bateson, I say, in all of your work, I know that you do, Coach Bateson works with all levels, from the professionals all the way down to youth. Coach, when you're programming in strength and conditioning, the idea, of course, not only is performance enhancement, but the some of the factors to prevent injury. Can you talk a little bit about that?
Yeah, cut out there for a second, Coach, so I didn't get the total intro, but I know where you're going. The strength and conditioning component is about performance enhancing, but it's also about injury prevention. That's a component that we don't want to forget about, because it adds value to that component of the athlete and that sport. So obviously we want to teach proper movements. It was in that sport, and then also proper movements within the strength and conditioning component as well. That's where we prevent injuries, because we need to train the body in the right planes and the right angles. Otherwise, we're creating strength at the wrong angles and wrong points, which I've seen happen because we don't take enough time, especially at the younger levels, to break it down into smaller groups so we can actually teach somebody and coach them in those fundamental movements. Once we've gotten those fundamental movements in place, then your body will memorize that movement because you have muscle memory. But I've seen it miss so many times. I know there was a strength coach at University of Pittsburgh baseball. One of the players that I had when he was in the pros with the Pirates, Jimmy Nagrich, was a client of mine as a professional athlete, and he would have that strength coach when all freshmen came in for the first year, the whole year, all their squatting with the bar was done with just the bar, no weight, until they mastered that form and technique, because a lot of them do not get it at the high school level. They're kind of left to their own accord, or it's kind of general and it's not specific enough. And I get that, because a lot of times the high schools don't have a legitimate strength coach, or the strength coach could have like every team. It's impossible. can be an impossible task sometimes. So I get that, but we need to start looking at those factors and breaking that down to a more specific, smaller group introduction to teach the right movements. And then as we get stronger in the right movements, that's where the injury prevention comes from. Not just being stronger is prevention of injury. Stronger in the right planes of angle, right planes of movement, the right angles of movement is where injury prevention comes in.
And thank you. And that's again, sport specific, right? There's so much to be learned. And again, WNY coaches can be a resource for many youth coaches who may not have the opportunity to have such training.
Correct. And I understand that too. Like they only know what they know, and they kind of have a lot of times they'll be an inch deep and a mile wide, of information. And that's when they need to put people around them that have more specific information. And at that youth level, we talk about specific for the sport. There is certain things that we will adhere to that are specific for a sport. But when we talk about foundation and the fundamentals of strength training for improved athletic performance and injury prevention, we don't need to reinvent the wheel. The basic movements are the basic movements. A squat is a squat, a lunge is a lunge, a press is a press, a pull is a pull, right? So those foundational movements need to be taught first.
Yeah, and we've talked about this. We're coming out very shortly with our youth coaching handbook, and I think these basic movements, Coach, you're going to have a portion of that handbook, basics on understanding the basic movements. It's good. Well, coaching, leadership style, and injuries. Is there a correlation? Is there a relationship? You've had varied experience. I know here we're talking about elite football teams, and that's again right up your alley. So,
there's always a correlation because the leadership determines what emphasis they put on different things. So I can tell you, like when Tressel was at Ohio State, I knew the strength coach there very well, and he that was a huge part of their program was the strength conditioning, where he would turn practice over at the end to the strength coach. All right, Eric Lichter. He's a phenomenal guy. Got known very well, but that goes under leadership. That head coach Tressel that was part of his program, and he believed in it strongly to be part of the program. So that's where leadership style injury prevention is going to be part of it, because if it's not on that coach's leadership format as a priority, then it's going to be overlooked. It's not going to, or there won't be the same emphasis put on it. It's going to be on the back burner. It's going to be a secondary thing.
Yeah, that's well said. That's well said, Coach. And I know that, again, talking about coaches' responsibilities at many levels, there are factors and circumstances where a coach may be, may err in judgment, right? The emphasis to, keep one of your players playing, and then you have the training personnel, medical personnel, right? You convene, you get a recommendation from the medical personnel. In some cases, right? Again, depending on the situation, not always. But the idea, I think, we revert back to youth coach and say, look, safety first. And if there's any question related to an injury, then you err on the side of caution, right? I mean, that's.
And I can tell you right now, there is still to this day a disconnect to some degree with certain programs. I'm going to say probably the majority of them, it was probably more the norm than not, where the medical staff, and I'll put the athletic trainers in the medical staff component, and the strength coach need to have a very cohesive relationship. They need to be one with each other, okay? Like I can do pretty much, I'm a bit of a hybrid, and I have a background in the athletic training and the sports medicine component, so I can do that full rehab as well as the strength conditioning. So I know where they cross and where they blend. So not all strength coaches are going to. And obviously, most of your athletic trainers are not going to know the first thing about strength and conditioning, really. don't know, some rehab stuff. But I'm doing a D1 athlete right now with a foot surgery he had, and I'm going to tell you straight up, he's a month behind where he should be because the medical staff at that particular university, the D1 school, was overly cautious. Where even the strength coach was like, no, we should be here by now. So the disconnect between that medical staff and the strength coach was very prevalent there. Because I have the kid here now, and I'm telling you straight up, he's a month behind where he should be. And I've been doing this for a long time, 35 years, so I've seen a lot of it. So that is we still need to bridge that gap. We still need to work on bridging that gap and getting the egos out of the way and work together on those things.
I think
that's
in terms of practice as well, I think what a lot of coaches are going to, when they see this, they're going to look at this and think, I maybe don't know when to push and when to pull back and take care of my athletes, and I think that's something you get in the gym, and the big question in my mind is it a lack of motivation or effort today, or is it just that their bodies are really tired and they can't go? Because we've all been in the gym where it's like, why can't anybody jump today? All of a sudden, everybody's hitting the tape with the ball, and it's like, is that a lack of motivation that you guys are bringing today? And then is it like we got to, get out of the gym for that reason? Or is it, all right, we need to do some functional stuff with our athletic trainers and our strength coaches to, just do something functional, get the bodies moving, but maybe not push them really hard today.
Yeah, like almost Blair, your point exactly. It's a great point. And do more of a recovery type of workout that day. And we have tools now. We're actually starting to monitor athletes, especially at the higher level.
Yeah.
With different tools like the Whoop. Yeah, the Whoop, for example, right? Where we can actually see where their recovery is and where their strain is. So if we had a big, heavy strain, our strain was way past our recovery the day before, you can pretty much expect the next day not to be as high an output because they don't have it in them. So that's truly a physical component. There's a lot of times you can tell the difference too. And kids might come in and they're just kind of all blah, right? Kind of down, kind of like no energy. And they're tired from the day, because I remember student athletes have a full day of schoolwork also. So that could be mentally fatigued. It could, and here's how you can tell if it's mental and physical. When you start getting them going and start to warm up and start your practice, the physical component should elevate and overcome the mental fatigue, because mental fatigue will make you feel physically fatigued in the beginning until you start something physical. Once you start something physical, you should see the elevation immediately. If it's not there, then it is a combination of mental and physical fatigue. So you need to know how to kind of read that.
And a lot of that for us, depending on what practice, sometimes we practice at 7 a.m., which is early for any college student. It's early for me as a coach. And who's getting the proper nutrition walking into that, right? Who ate something before they came in? So there's so many different components.
Who ate what they should have? Who had the right meal the night before?
Yeah, right, exactly.
Yeah.
Who got enough sleep, and that's what those things all track as well, which is kind of crazy.
Thanks, guys. That's so important. And I think when we also talk about leadership, we're talking about youth sport organization directors. We're talking about athletic directors, right? In coaching leadership, yes, we're talking about the head coach, but we're talking about a systematic philosophy, which I think, as we always say, comes from the top. So
yeah, leadership from the top down, from the institution all the way to the court or field or ice, right?
Right. Thank you. Coach, talk to us a little bit about eccentric exercise.
Well, there's that's the component where strength is really developed, all right? And it's an easy part to bail out of, okay? There's the concentric and eccentric component of contraction. So let's take the bicep, for example. If I'm curling that up, all right, that's my concentric contraction. When I extend my arm out and let it down, now the bicep still has a load on it, right? That's the eccentric contraction. And that And that's the same, let's take a bench press. I push it up, that's concentric. I'm letting it down, that's eccentric. That's where strength is really developed, is in the eccentric component. But that's the easiest one also to kind of like disengage it and then re-engage, as opposed to staying totally engaged in the complete eccentric part of that exercise is what's very important. And that has to be coached. That's just a coaching point. Once again, if I have a group of 15 kids, that's more difficult to teach those specific training points. That's why I like to break my kids down into groups of 3 to 4 kids, 6 max. Otherwise, you really can't coach specifics, especially when you got youth athletes and you're really teaching them the foundation. This is very, very important because there's too many programs out there that will never teach us what eccentric even means, or what the right form is, because they put them in they do all these groups of 10, 12, 15 kids at a time. Well, that's great if you want to do some body weight movements, some calisthenic stuff, and run some drills, but you can't coach them in specific control of movements with that many kids. You can't do it.
Yeah. I've often heard you say that they have to be coached through it, right? Each individual has to be coached through it.
Mhm.
And even in regards to rehab, when you're rehabbing and they have the identified injured arm or leg, injured part versus the healthy part, can you talk a little bit about utilizing these exercises in rehab?
That the rehab component is going to be the most important time to do the coaching. Okay, like any part of coach, you gotta engage that athlete or that person mentally as well as physically. All right, so that's why the rehab component sometimes is really lost, and they might clear an athlete because the movement is good and they can get dressed and they can move full range of motion. It doesn't mean they're ready to play yet. I can guarantee that, because there's still things that probably aren't firing at 100%. There's a misfire, or there's not 100% contraction of that muscle through the full range of motion, and that's going to lead to another injury. Maybe not the same injury, it'll lead to something else being injured. So that the coaching component in the rehab, I can't even emphasize how important it is, and it's not really taught. When you go to rehab stuff, and that's where the athletic trainers might do your rehab, they'll give you the exercise, do it on your own, and get it done, and they're really not going to pay a lot of attention to it. And that's where most of the attention needs to be paid attention to, is at the beginning part of that rehab.
Coach, you talk about these relationships, like you say, between the trainer and the strength coach, for example. What about the physical therapist and the relationships with athletic personnel?
All one the same. I'll put the physical therapist right in there with the athletic trainer. All right, they're kind of in that same category, because the PTs that I've dealt with, a lot of them. There are some that are very, very good. There's some that are very just basic and generic, and they're going to get you to a point A. That's their job. That's it. I always come in and like I can get you to point A, but let the physical therapist do that, because that's just kind of boring for me. But I'm going to bridge that gap from point A to game ready, and that's where it gets lost. There's that gap from I can have full range of motion and I'm functional, but my strength isn't there yet. So I'm not really ready for a full strength program yet. I need this interim gap filled. So it's really still rehab. It's really not full strength training. It's still a component of rehab that usually the physical therapist isn't schooled in and will miss. And that little gap is where it gets lost between, hey, you're cleared, you got full range of motion, but you're really not ready to go back on the field or back to full training in the strength in the weight room yet. And that's where there needs to be a connection with that PT, that athletic trainer, and the strength coach, and get on that same page and work together. And I've seen it. I've seen it work together at the professional level sometimes very well. And I've seen it be totally separate, where they don't even communicate with each other, which I don't understand, but it happens more often than not.
Yeah.
And that's leadership. Let's take a step back, and that goes back to leadership. The head coach should make sure those connections are made, not like, hey, that's not my department. It is your department if you're a leader. The whole thing is your department.
Yeah. I noticed I had surgery on one leg and not the other. And I notice now, still to this day, 10 plus years later, that I'm functionally better, body weight stuff. I'm stronger in my one that I had surgery on because all of the movements and all of the rehab that we did before surgery, after surgery, even right after surgery, all of that made that leg so much stronger as a whole. It's
Yeah.
just interesting because you would think that would be my weaker leg, right? I mean, I
No,
didn't.
but you went at it. You went at it to rehab that properly. Here's the mistake that was made: was they should not ever negate the non-compromised side either.
The
They
non-compromise.
need to mesh and work together. So a lot of times when we do things, I'll always involve the non-compromised side so that so neurologically your body reads what it's supposed to do evenly. So the non-compromised side helps the compromised side improve and not over improve past the non-compromised side. They need to mesh and be equal. If that makes sense to you.
Yeah, that makes sense.
It does make sense. Boy, I tell you, just thinking about parents as we're talking, right? Wow, that's overwhelming, right?
Yeah.
Who are you listening to? Who do you go to? I mean, the good news is they can go to Coach Bateson and WNY Coaches. That's the good news.
Right.
They're talking about early specialization, Coach, and there's a lot of talk about, youth sports, how much time youth are putting forward in playing sport. Parents' emphasis on, future potential, athletic goals, but there's a caution flag being waved here. And I know we've talked about in other trainings, we've talked about how there has been a myth, right? But it's over now. We can start, for example, strength and conditioning at a younger age.
Correct. We spoke before about this. They all these subjects they're all connected. They're not really individual silos. They all intertwine with each other. We have talked about this component before with youth, especially younger athletes. You want to start those foundational movements right away. It might be with body weight. Once they have the body weight movement down properly, you start to add a load to it. We know that we're not going to damage growth plates. Like I said before, in the 80s, early 90s, that wasn't a myth. It was just we didn't know, so we erred to the side of caution until Dr. Wayne Westcott disproved that when he was at Penn State, that we do not damage growth plates. So we know that doesn't happen. But once again, the young athlete, especially the preteen athlete, has to have the mentality to be able to accept that resistance or that load and handle it and deal with it and not just give into it. So it's really at that younger age when we talk about getting them ready, strength-wise, skeletal muscle-wise, they have to still have that mentality to focus on that. And I would say preteen athletes is probably 1% to 2% that really can have that. And I've dealt with a lot of them. That's why I can say that, because there's a lot of them that just don't, you hand the weight, all of a sudden it loads up and they feel that resistance and they start looking somewhere else or they just stop. All right. So you can try to engage them to a degree, but the ones that are preteens that are really ready, embrace that feeling and move through it.
And I know, again, we all have our own perspective here. I asked both of you, what are your thoughts about this idea of specialization? One sport, 8 to 12 months a year versus encouraging participation in other sports.
If I specialized early, I would be a 6'5" softball player.
Third base, right?
4-foot strike zone.
Great picture. Great picture.
I mean, I grew up, I played pretty much every sport I could possibly play. My dad was a little league coach. I played basketball. I didn't start playing volleyball until almost high school. And so I remember volleyball was like the last one on my list of things that I could do. I was playing multiple club sports, multiple high school sports. And I'm so glad that I did all of those things, because I think in general, it just makes you a better athlete. It makes you a more well-rounded athlete. When we were recruiting, I loved multi-sport athletes because they can make movements and do things with their body that are different than someone who's only been trained in volleyball. Like, you see them make different plays. They're just athletic in a different way.
No, the younger pre-teenage especially, you
Mhm.
want, I think, involve them in multiple sports to find out, what they want to do, what they enjoy doing also, maybe
Right.
something that you never thought they would enjoy.
Mhm.
But as they get into the teens and the high school era, not that you can't do multiple, I did multiple sports, but I didn't do, like, they wanted me to do track in the spring, and I didn't, because I needed that time to
Recover.
strength train properly to get my weight up for football, because that was my goal. So I football and wrestling were my two sports, but I didn't do anything in the spring. I used that as a total training session for football, which is my goal for a scholarship in the next level. Had I not done that, I wouldn't have had the strength level I had, which helped me get to the next level, which turned some heads with some coaches and say, hey, yeah, look at this kid. And also I've seen so many parents take their kids where, like hockey's a big one, for example. It's been really become a year-round sport, and they have them playing hockey year-round and then throwing another sport on top of that, and that's almost too much. It's like, hey, if they're gonna play hockey year-round, then play hockey year-round. But if you're gonna try to throw like lacrosse on top of that in the summer, when they're already playing a hockey league, there's not a lot of downtime. There's not a lot of time to train. There's not a lot of time to improve your strength and conditioning, improve your size and speed when you're always in game mode. So that's a decision you got to make. The athlete has to make, and the parents need to help them to work with them on that. I'm not saying not to do it, but say, hey, maybe you don't play hockey year round then.
Right.
Maybe you say, hey, I'm going to play this season, and then you have a season for each thing, and you have to give yourself an off season for recovery and strength and conditioning. Otherwise, you're never going to make the games. Like if I'm going to tell you a perfect example of it. They wanted me to wrestle in college, and I'm like, no, I'm not going to, because I would have never been able to keep my weight or get my weight to 255 pounds. They wanted me to suck down to 190 to wrestle. I'm like, not doing it. So I could have done that and been very successful in both in college. But I wouldn't have been able to fulfill what I needed to fulfill at the next level and have a professional shot.
Yeah,
Right,
it definitely depends on your goals, right?
Yeah, it depends on your goals. What are you trying to accomplish?
Yeah.
Yeah, if we just want to have fun, like Blair, that's a great example, and I'm glad you brought that up, because I had a kid that was doing the hockey lacrosse thing, and it was legitimate, a D1 prospect in lacrosse. And I got those parents to listen. I'm basically training the kid in an in-season program year round. Because you got them playing hockey and lacrosse, and they overlap. They're playing at the same time. I said, if he wants to get a scholarship, he has a better shot at a scholarship in lacrosse than hockey, then you need to like just focus on that. Use hockey as like a fun activity you can still play. But if you're going to go both these head on, you're going to end up with nothing. And that's exactly what happened.
And I think what's important to note is maybe the coaches don't recognize that when you're training in season and when you're training out of season, those are two very different types of training. When you're training in season, you're more focused on that recovery piece, right? To make sure you're maintaining everybody. But in off season, you're more focused on strength.
Yeah, well, basically what happens in the in season, we reduce the increase the volume, reduce the intensity. Intensity doesn't mean my psychological intensity. Strength and conditioning intensity means the amount of weight.
Because you have to play on the weekends.
Right. And off season, we're going to go higher intensity and lower volume, and that's how we get stronger and bigger, right? So if we don't ever have that off season,
like that.
you're never gonna reach that goal.
Right.
So what is your goal?
What is your goal? Is right. There's, again, thinking about the parents and the youth coaches, what kind of advice do we give them? Where could they go? And I'll say it again, wnycoaches.com. We're at least here to have that discussion, because there's everything to be said about overdoing it.
Mhm.
And yes, young people have a goal or they have the joy of participation, but sometimes, as we know, it's not the youth's goal. It's the parent goal.
Right. Good point. Great point, Coach. Like um, I've had that conversation with some parents, like basketball, for example. That's becoming year round also now because they play the basketball season, which is probably one of the longer seasons even in high school, right?
That in baseball, right?
Yeah, and they then they'll play in the whole summer league. So I'm like, okay, they bring them in. They want to get them stronger and bigger. It's like, well, where's the downtime here? So make a choice. The summer league you're playing in, how important is it? Is it just to stay in, maintain your skills and stay on the court? Because if that's the case, that's cool. Then I can train you as a true off season, and that's going to be really secondary. If that's a primary thing, then we're still in an in-season program, and we're never going to get bigger and stronger.
Yeah.
So decide what's important
Yep. Just,
and when.
yep. Priorities. Thank you. Again, coming back to you, Coach Bates. It's an early versus delayed rehab after an acute muscle injury.
There's like when you cut out in the beginning, Coach, on that intro, but the when to start the rehab on an acute muscle injury?
Yeah, if it's an acute muscle injury, early versus delayed rehab.
Okay, and I've done this to myself many times as well. I am a big proponent of starting rehab immediately to at some degree, never letting it totally shut down neurologically. And that's what happens with an injury, especially a muscle injury, is when you stop using it, stop moving it, stop engaging it, neurologically it shuts down. And now basically what happens is your central nervous system, which is command central for your entire skeletal muscle system, it puts a cone in the road. And we're going to detour that area now. We're going to go around it. So when we start a delayed rehab, it takes much longer to get the muscle to engage neurologically. All right. So when we do, a conventional movement, it's 2 contractions per second. We have to do a lot of that to catch up to the non-compromised side. That's why I always involve the non-compromised side. What's the compromised side? Because we get about a 10 to 15% transfer neurologically. All right. So I'm a believer, it's like, hey, as soon as I can start some movement on that muscle, even if it's a passive movement, a light movement, I start it right away. I really don't wait. Like, hey, shut it down for 10 days. I'm talking even post-surgical stuff. I'll take a joint and start moving it manually right away, just to send a message to the nervous system. Don't turn off over here. Don't put that cone in the road yet.
Yeah.
Yeah,
exactly what
that scares some people that are in the business, like some physical therapists, or I don't mean to pick on the PTs and the athletic trainers, but a lot of them have never been hurt themselves. So, and I've had 5 knee surgeries, shoulder surgeries, so I've done a lot of rehab myself as well, so I can speak firsthand on it, right? And they always err to the side of ultra caution. And I'm like, no, I've done this many times with professional athletes. I'm very confident in what I'm doing and how to do it. And let's start this movement immediately, and we're going to get a much faster recovery.
Yeah, and as you said, you started early, but you're careful with, at what level of movement.
Exactly. It's all adjusting to where we're at, meeting that person or where they're at. Not just saying, okay, hey, the first X amount of weeks we do nothing, and then this is the next amount. That's good to have that format as a template.
Right.
But you have to call audibles with that constantly. If you just stick to that template, you will not progress very quickly.
Well, and it is individual circumstance, attitude, strength. Before, Coach Blair talked a little bit about, kind of training before your surgery, right? Did some of that prep.
Yeah, we call it rehab now. Yeah. Yeah, very, very important. Very, very important. And actually, it's actually that real tool that we use as strength coaches constantly, and they're starting to really get involved in the prehab before they have something surgically fixed.
Right. Prehab. I like it. Thanks for the term.
Right.
Okay, talking about return to sport, Coach. Again, you're involved in many of these discussions with coaches, with trainers, with doctors. How do you approach that dynamic when, like, if you're the one helping with the rehab and your sense as a professional is that they're ready to return, and then there are challenges in that perspective, how do you approach that?
Well, I've been doing it for a long time, so I have some relations with some of my orthopedic guys. My docs, like when the athlete asks them and they know they're working with me, they'll just say, "Don't worry, Coach Bateson, he'll tell you when you're ready." And they just step out of it now. They don't even say, "Hey, well, 6 weeks this, 8 weeks you'll be here." They just step out and say, "He'll tell you when you're ready." All right, and that is about functionality and being able to test to see where the firing responses of that muscle. Like the athlete I had with the foot surgery. So I did a couple basic movements on him, and I could see that his ankle flexion, pronation, supination was delayed when he put a load on it compared to the non-compromised side. So now before I can say, okay, and he was almost clear as far as like full range of motion of things, but he had some, other muscles that weren't engaging properly. So there was some stiffness and soreness there. So I said, you're not ready to go on the court, even to shoot around, until we have that ankle moving at the same speed with a load as the other side. So now we can approach this on a strength component. So you can, and that's where sometimes it gets misdiagnosed. It's like, hey, you were cleared, but they're not really checking it neurologically in the strength component. And then they're going to go out and they're going to get hurt because they're really not cleared strength-wise yet. So that I've seen that happen many times. So you want to, empower the athlete to take responsibility for it and do the work, but you got to also sometimes don't let them get too zealous and back them off a little bit, so you're not ready to do full speed movements yet.
Yeah, and there's a team that you put together here, right? There's a team of professionals that are involved in, monitoring progress. Like if the doctor sends them to you and says, Coach Bob will tell you when you're ready, which is great, but the doctor's still involved, the parents still
Yeah.
involved.
Oh yeah.
Yeah.
Yeah, and I think even from our perspective, working at a big institution, at a university, we would have athletes go to, say, PT at home. And you're right, when they would go to their physical therapist, it would be like a range of motion to make sure that range of motion is all the way where it needs to be. And then when they would come back to us, we were so fortunate to have amazing athletic trainers that knew how to work with our strength coaches and, like you say, fill that gap from like range of motion is good, which is awesome. And like, we're so glad we're there, but to being ready to play at their highest level again, there can be that gap there. And that's kind of the space that you're talking about, right?
Yeah, I'll even 100% correct. And I'll break it down like even something very basic. My wife broke her leg, lateral tibial plateau break. So it's a weight bearing break. So there was nothing really to splint or to cast. It's about just don't put any weight on it. All right. But they immediately put her into a splint, right? And now the average person is going to keep that splint on for 8 weeks. All right. So now we have a whole different line of issues. Now it's not about the break anymore. It's about immobilizing that leg, created all the soft tissue neurologically to shut down. So that's what the rehab's going to be, not with the break. Well, what I did is actually when she got home, I took the brace off. I said, take the brace off. We don't need it. The average person might wear that brace because they were told to. And that's the protocol. But I said, you're going to do is you can't hurt it as long as you don't put weight on it. So you're going to sit, you're going to extend your leg and contract your hamstring, contract your quad, extension and contraction, and keep it moving the whole time. And that way, when that break calcifies, there is no rehab for that injury because we don't rehab a broken bone. We rehab the soft tissue around it. Well, I never let the soft tissue shut down.
I see.
Right. So we talked about that a little bit earlier.
Yes.
And when she went back to the doc, he's like, oh my God, like, you have great range of motion. Well, yeah, because he would just say, keep the brace on.
Protocol.
And the majority of people will, because that's what the protocol is, right?
Right.
But you can't, but I understand it with the injury, and that's my field. So it's like, listen, you can't hurt this by moving it. You can only hurt it if you walk on it. So stay on your crutches, and we're going to move this leg every day. We're not going to brace it. So our rehab, when that bone healed up 8 weeks later, she was already ready to go.
Nice. That's a perfect example. And
Right.
I know she listens to you.
Yeah. And don't always.
Maybe just with that, right?
But that is a perfect example of like where I will think out and push that envelope out of the box a little bit. Because you know me, I'm always pushing that envelope. Where your traditional PTs or PTs being athletic trainers or PTs are going to like stick with that protocol, and that's what they know. That's what they were taught. But being involved in it so long and being around it so long, I know where to push that to, so it makes it a little bit different. Like Blair, you mentioned how your athletic trainers were very involved in bridging that gap. That's awesome, and that's where you're going to see any big D1 schools that and professional athletes. That's how they get back so fast, is because there is a good connection. Most of the time, or the schools that do have that fast rehab, they have that connection.
That's great. And I think here in this slide, we're talking again about the idea of having collaboration and a team involved in each and every student athlete, right? So again, encouraging parents, yes, you take the advice, you take the lead from the doctor. You have a PT perhaps, you have a strength guy, or you have a rehab guy like Coach Bateson. Have everybody part of that feedback and monitoring the progress. I think that, and it certainly seems like that's important also for the athlete, right? That they can see there's a team together making sure that things are moving along the right direction.
And most importantly, that they're all on the same page, right?
Yes.
Which is a great challenge, but
It is. It really is.
Yeah.
It is. It's in that field. It is.
Well, we have a few minutes here, coaches, and now we're talking about using mental imagery and visualization in rehab. Coach, I know I'm Coach Bates, and I'm back to you again because I've witnessed you utilize this in talking about this ownership of the injury. So you using mental imagery, talk a little bit about that, please.
Yeah, as we had discussed that before with in the game and on the court, the mental imagery is very, very important, because what happens to anybody when there's an injury, that particular body part is almost like disconnected. It's like, it's out there, and people are afraid that it was hurt. You know what that pain was like. I don't want to feel that again. And to bring that back physically, you have to engage mentally. All right. And you have to like kick the cone out of the road of that injury so that you can mentally bring it back in and make it part of you again. And I've seen athletes at all levels never fully get back to full speed for that reason, more of the psychological reason than the physical reason. They never really like re-owned that as theirs again. I was like, God. And I've watched athletes at all levels never fully return. And it's not that they couldn't, it's that no one coached them through it psychologically.
Well, Coach, we have to get a cone on one of these slides because you bring it up a lot. And I get it though.
I remember my first jump after my ankle reconstruction. I'll never forget it. They had a little tiny box for me to jump on. And I was just standing there, and my athletic trainer, who went on to become the national trainer, or the national team trainer, she was awesome. She told me, she said, okay, today you're going to jump. I was like, I'm not jumping. I can't jump. I just had surgery. I don't know if you heard this or not. And she's like, you can jump, you can do it. And I just remember every day more and more and more. But I had so much trust in her as my trainer and in our strength coach and in our coaching staff that I'm just like, okay, if you say I can do it, I know I can do it. So let's go.
Yeah,
Well, let's talk that was, I'm gonna just comment on that point because you made an excellent point on you, the athlete, had confidence in every component of your team from the top down, right? From the
Yeah.
head coach to the trainers, all right? That's why you're a 4-time national champ.
Well, they are.
Right?
Right. They are why,
but
right?
yeah, those
No,
relationships.
but that truly is why, because the athlete needs to trust in that whole system.
Yeah.
Yeah.
Mhm.
Yeah, a lot to be said about that is right. The relationships pivotal in
Yeah.
everything that you do.
I mean, we had an ACL surgery. It wasn't mine, but it was a teammate of mine who came back and was an Olympian. I mean, it was like she was stronger when she came back from her ACL surgery than she was before.
That's just the mentality. You know, we had a kid last year, a basketball kid, plays at Benedict in South Carolina. ACL, they told him he'd missed the following year. He'd be out for at least a year. He played the whole season this past season.
Yeah.
Yeah.
So after the ACL, I think he was back in 8 months, full go, 7 months maybe.
Well, again, and moving forward here, we talked a lot about prevention in youth athletes, but in this slide here, just to summarize, right? Taking a rest, be careful of specialization before, preteen, as you would say, coach. The idea of taking a close look at total hours per week, this rest component and respite from the pressures of participation are very important.
Yeah, and coach, there is the resting is so component, but not the physical rest, but also the mental rest. So sleep is important, all right? And we do have a bit of a problem with some youth athletes because of the gaming and the Fortnite and that stuff. They end up staying up, all
Yeah.
night. And then they go to school the next day, and they're in school all day, then they got to practice or a game, and they're not really recovering.
They're not recovering. They're not rested.
Mhm.
Can't even, there's not enough emphasis you can put on the importance of rest.
Right.
It's true.
But I had that problem with a couple of younger athletes in here last summer with coming to this drag. I said, "What's wrong with you guys?" Like, up all night playing Fortnite. Well, it's like,
Yeah.
you got to
Yeah.
make a decision, man. It's like,
Yeah, make a decision. Again, this slide, coach talks about a lot of what you talk about, coaching people through the exercise.
yeah. Which is like we discussed that the importance of that is and also the athlete, they want to be coached. They're looking for that. They're looking for that direction and that help.
They do.
Whether it's on the whole exercise, on one specific movement of that exercise, they're receptive to that.
Yeah. I think I still like to be coached when I'm in the weight room. I think it's a good thing because you're doing it right and you know what to fire and it's like it's good to be coached through it still, even though I've been doing it for years and years and years.
Absolutely.
Blair,
All you need to do is come to Body Blocks.
No,
Right.
but Bill, that's so true. You've been around me. How many times have I called out our kids when we're in the weight room and I'm watching them? We're going through the exercises, and I'll see a kid put on a weight that I know he can do more, and he just wants to say check it off once I did it. And I'll say, hey, great warm-up set, now put more on and do a real set. And they're responsive to it. They'll do it, but left to their own accord.
Yeah.
Sometimes they'll take
that kid in college, but now it's so different. I enjoy it. I really enjoy it and enjoy seeing a change in like feeling stronger and feeling better and all of that. And so I think maybe that's just because I'm older now. Maybe it's because I'm paying for it.
Evolved into that. Now you're doing it. Before it was really focused for your sport.
Yes.
Now it's a lifestyle for you.
Yeah.
Evolved into a
Lifestyle, right.
lifestyle.
Exactly.
Coach is on it right now, man. Coach has been consistent 2-3 days a week.
That's great.
Yeah, it's been great.
Feeling better?
Feeling better.
I'm feeling better. I don't feel like my back's going to be gone in the morning when I wake up anymore.
That's good. That's good. Well, this slide here, talking about modalities, massage, movement and strength conditioning, psychosocial interventions, we're going to pick this up during our next training. So I want to wind down here and ask for just any final comments, coaches. I guess I would ask for a message. I would ask for a message to Little League coaches in how to handle the thought or the situation when you have a young person with an injury.
I mean, I think Bob will speak to the physical side of that, but I think for me, and this is what we'll get into in maybe our next training, our part 2 of this,
Yes.
is the psychological side and making sure that you're including that athlete and making sure they're still part of the team, checking in on them, and just making sure that they don't feel like such an outlier that they lose their motivation to come back and want to be a part of it. That would be my big takeaway.
That's
Yeah,
a great-
that's a great point, Blair. And you can see that a lot of, to your point, programs, you'll see injured players that will travel. They'll go on road trips. They're part of the team. Don't exclude them. That's a very, very good point. And at the youth level, same thing. Don't make the kid feel like, hey, don't come to practice. No, you come to practice and you're part of the team. You'll sit here and watch practice like be part of like everybody else. On the physical side of it, as a youth coach, you can also get involved with that doctor or that PT person and the parents that are taking care of the kid to kind of, so where that kid is at. Be involved with all the kids on your team, as when they're injured or not injured, and know where they're at. So how's the injury coming? How's the rehab coming? Know where that component's at. So that the coach is as engaged and involved with the kid that's injured as the kid is involved with the team.
Yeah. Again, back to relationships and communication and a team effort. Well, coaches, that concludes our training for today. Thank you all for listening. Thank you, coaches, for being with us. We look forward to the next one. Let's work together to protect our young through sport. Thanks, everyone.
Thanks.
Thank you.